Hi everyone, welcome to my YouTube video. My name is Gareth Jim. I'm a student at Marwadi University and I'm studying physiotherapy. Today we're going to be talking about the anatomy of the knee joint and the popliteal fossa. What is the knee joint? So, the knee joint is the largest and most complex joint in the human body. But before we go deep into our lesson today, when discussing any joint of the human body, we need to describe it according to the following topics or headings. We need to talk about the introduction, the type of joint, the components of joint, the ligaments at the joint, the articular surfaces, the movement at the joint, the stability, muscles producing movement, blood supply, nerve supply, and last but not least, we need to look at the applied anatomy. So let's go into a lesson. The knee joint is one of the most complex and important joints in the human body. It connects the thigh to the lower leg, allowing for movement like walking, running, and jumping. But what type of a joint is a knee joint? A knee joint is a synovial hinge joint. A synovial joint is a joint formed by bones that are separated by a space called a joint cavity. So if we look at this image right here, you see our two bones, and these bones are joined together by an articular capsule, but between them there is space, and this space is the joint cavity that connects the bones. In the joint cavity, there is synovial fluid, and we'll look more at what the synovial fluid or what the joint capsule does as we continue with our lesson. So we said a knee joint is a synovial hinge joint. A hinge joint is a joint between two bones that performs only one movement or movement in one axis. Uh, for example, if you take a look at a door and a door frame, there is hinges between the door and the door frame that allow for movement for the door to move forward and backwards. So it is like this. So this is a hinge joint. It only makes movement in one axis. Uh, if we take a look at this picture, the blue portion that is the knee joint that is in front of our leg, and behind our leg there is a diamond shaped hollow behind the knee joint. This area is called the popliteal fossa, and it houses vital nerves and vessels. We'll look at that after we've looked more into the knee joint. So remember when we spoke about the knee joint, we said it is a complex joint. But what really makes this joint a complex joint? So the knee joint is made complex because of the bones that create joints on it. So it is made by these bones, the femur, the tibia, and the patella. These are the bones that form the knee joint. But between the femur and the tibia, there are two joints located laterally and medially. And laterally, we've got the femorotibial joint. Medially, we've got the femorotibial joint also. Then there is a joint between the femur and the patella, and that is called the femoropatellar joint. These are the joints that make the knee joint complex. So let us look now at the ligaments of the knee joint. So we have quite a lot of ligaments at the knee joint. I'll name all of them first, then we'll look at the most important ligaments that are usually looked at by everyone else. So we've got the fibrous capsule. So whenever we're looking at any synovial joint, the first joint should or the first ligament of that joint is the fibrous capsule. A synovial joint is lined by a fibrous capsule. That is the capsule that surrounds the, the knee joint. So we've got the fibrous capsule, that is one. Two, we've got the ligamentum patella, that is the ligament from the patella to the tibia. We've got the tibial collateral or medial ligament. We've got the fibular collateral or lateral ligament. We've got the oblique popliteal ligament, the arcuate popliteal ligament, the anterior cruciate ligament, posterior cruciate ligament, medial meniscus, lateral meniscus, and last but not least, the transverse ligament. So altogether, we've got about 11 ligaments. And the function of these ligaments is to act as shock absorbers or distribute synovial fluid that is in the synovial cavity, on the joint cavity, and divide the joint into two parts, which is the upper part and the lower part. But when people talk about the knee joint, these are the joints that are usually looked at. We've got the anterior cruciate ligament, most commonly called the ACL, which prevents forward movement of the tibia relative to the femur. We've got the posterior cruciate ligament, which is the PCL, which prevents backward movement of the tibia. So the anterior cruciate ligament and the posterior cruciate ligament, these ligaments are aligned as a cross like this. So the posterior one is behind, which is posterior. Anterior means in front, which is in front. So they are lined like this as an X, and they prevent forward and backward movement of the tibia relative to the femur. Then we've got the medial collateral ligament, which is called the MCL, which provides stability to the inner side of the knee. And we've got the lateral collateral ligament, which is known as the LCL, which provides stability to the outside of the femur. So if we take a look at the knee joint here, the on the medial side and the lateral side, that's where we find the medial and lateral collateral ligaments. I have a picture below. I'll show you where most of these knee joints are and how they are located. So the knee joint also contains the meniscus, which are C-shaped cartilage structures that act as shock absorbers and improve the fit between the femur and the tibia. So this video right here shows the ligaments that are at the knee joint. So as I said, the anterior and posterior cruciate ligament, they're lined as a cross like this. These are found right between the knees, the anterior in front and the posterior behind. Then on the sides of the knee, we've got the lateral and the medial, or the lateral and medial meniscus, which is our C-shaped cartilages. These are right between the tibia and the femur. So these act as shock absorbers that prevent the bones from hitting each other. Then also we've got just right outside, medially and laterally. Laterally, we've got the fibular collateral ligament, and medially, we've got the tibial collateral ligament. Then between the patella and the tibia there is our patellar ligament, and the transverse ligament, as the name says, transverse, it crosses from one side to the other side. These are the ligaments of the knee joint. Now, let us look at the functions. The functions of the knee joint. The primary function of the knee joint is to allow movement of the leg in relation to the thigh. This includes flexion. Flexion is bending of the knee to bring the heel towards the buttocks. This is flexion. So flexion is when we move our knee backwards, so that such that our heel touches our buttocks, and extension is extending the knee from flexion going back to the original position. This is straightening the knee to return to a starting position, which was standing or whatever position that we may be assuming. Then now let us look at the stability at the knee joint. What makes the knee joint stability? So first we've got our synovial membrane. The synovial membrane, it lines the capsule except posteriorly, where it is reflected towards by the cruciate ligament, forming a common covering for both ligaments. So if we look at this image, we can see our synovial membrane, the orange part. That is our synovial membrane. The synovial membrane lines the capsule such that there is stability on both sides, laterally and medially, of our knee joint. Then, when you look at the front of the knee joint, you will see the patella, also called the kneecap. It is a small triangular shaped bone that sits inside the quadricep tendon. The kneecap is covered with cartilage, which is the thickest in the whole body. This is because it takes a lot of pressure. Like when you go down the stairs, the force of the kneecap can be about 3.5 times your body weight. So our knee joint will be located right between the knee joint, and it is lined by the patellar ligament. That's where the patella is located, and it is lined by the patellar ligament. Now, we also have a bursa. Bursas are small fluid-filled sacs that reduce friction between the bones and soft tissues to prevent inflammation. So bursas will be located mostly on the tibia to prevent inflammation, and they are small fluid-filled cavities. So now let us look at the muscles producing movement at the knee joint. So our first movement will be flexion. Flexion is bending the knee backwards, the leg move backwards. Okay. The principal muscles for flexion include the bicep femoris, the semitendinous, and the semimembranous. These are the principal muscles, but they are not all the muscles that act or that are included in flexion of the knee joint. And extension is straightening the leg or moving the leg back to the original position or the starting position that we had assumed. So the chief or the principal muscles that help in extension of the knee joint are the quadriceps femoris. The medial lateral rotation. This is turning the lower leg inwards when the knee is bent. So as we've said before, there are only two movements that can occur at the knee joint since it is a uniaxial joint. But when the knee is rotated um, or slightly okay, when the knee is bent, we can rotate it medially and laterally. When rotating it medially, the semitendinous and the semimembranous and the popliteus are the muscles that, or the principal muscles that help in the medial rotation. In lateral rotation, this is turning the leg laterally when the knee is bent. The bicep femoris acts as the principal muscles. Excuse me. So let us look at the blood supply and nerve supply. For the blood supply, we've got the five genicular branches of the popliteal artery, the descending genicular branch of the femoral artery, the descending branch of the lateral circumflex femoral artery, two recurrent branches of the anterior tibial artery, and the circumflex fibular branch of the posterior tibial artery. These are the blood supply that supply the knee joint. Now, as for the nerve supply, we've got the femoral nerve. This comes across with the vastus medialis, and we've got the sciatic nerve, which also divides into tibial and common peroneal nerve. We've also got the obturator nerve. This is the nerve on the posterior division of the knee. So in front, we've got the femoral nerve, then medially, we've got the sciatic nerve, and posteriorly, we've got the obturator nerve. Now, let us look at of the clinical significance of the knee joint. So the first one, we've got the osteoarthritis. Osteoarthritis is a type of arthritis that happens when the cartilage that lines your joints is worn down or is broken down over time and your bones rub against each other. So when your bones rub against each other, friction is created and this friction causes the bones to tear or worn out, and this causes osteoarthritis. So, what is the treatment of osteoarthritis? While there is no cure for osteoarthritis, the patient, however, can get pain relievers over the counter, or they can visit the physiotherapist for some exercises that strengthen the knee, or that strengthens the upper leg, which is the thigh, and the lower leg muscles. The second, we've got the articular surfaces, which are not congruent when the joint is weak and you are fragile to fracture or um, whatever diseases or infections that may occur. We've got deformity of the knee joint. This is when the knee joint is abnormally adducted or abducted. Then we've also got injury to the knee joint. Injury to the knee joint would include the injury to the meniscus, which is our C-shaped cartilage that is between the joint, or the cruciate ligament. This is the joints that cross each other, either the posterior or the anterior cruciate ligament. So this was about it of the knee joint. Now let us look at the popliteal fossa. What is the popliteal fossa? The popliteal fossa is a diamond-shaped depression that lies behind the knee joint, and it is formed by the lower part of the femur and the upper part of the tibia. So if we look at this image right here, we can see muscles that form the popliteal fossa. So usually it is a diamond shape. I don't know if you're gonna see it, but medially or superomedially, we've got our two muscles, which are the semitendinosus and the semimembranosus. These are our superior medial muscles. Then inferomedially, we've got one muscles. This is the gastrocnemius muscle, the medial head of the gastrocnemius muscle. Then superolaterally, we've got our biceps femoris, and then inferiorlaterally, we've got two muscles. We've got the lateral head of the gastrocnemius, and we've got the plantaris muscle. These are the muscles that form the, the popliteal fossa. So let us look at our roof of the popliteal fossa. The popliteal fossa, the roof is formed by the skin, the fascial latter, and the deep. The floor, however, is formed by the lower part of the femur, the upper part of the tibia, the knee joint, and the capsule of the knee joint. And remember what we said about the capsule of the knee joint. The capsule of the knee joint is a synovial. The knee joint is a synovial joint, and it is formed by the joint cavity. Our capsule of the knee, remember what we said when we spoke about the ligaments of the knee. Whenever we have a synovial joint, our knee is formed by a capsule called a fibrosis capsule. Now, the bodies of the popliteal fossa. We've got superolaterally, superomedially, inferolaterally, and inferomedially, as we've discussed on the image that was above. Now, what is in the contents of the popliteal fossa? Remember when we talked about the popliteal fossa, we said it has got our nerves and vessels, important nerves and vessels. So we've got the popliteal nerve, the popliteal artery, the tibial nerve, the common peroneal nerve, and also we've got fat, a bit of fat, and we've also got our lymph nodes and the popliteal fossa. So easiest way we can remember the contents of the popliteal fossa is by the Minogue never volunteer again. N, that is for our nerve, which is our tibial nerve. V, which is for our vein, which is our popliteal vein. And A, which is for our artery, our popliteal artery. What is the clinical anatomy of the popliteal fossa. So the popliteal fossa could be faced with popliteal aneurysm. This can be the compression of the nearby vessels causing pain or weakness. You've also got the Baker's cyst, which is when a fluid-filled swelling from the knee joint that can develop in the fossa. And we've also got nerve damage, which is injury to the nerves in the popliteal fossa, which can affect the leg movement or sensation. This was it for anatomy of the knee joint and the popliteal fossa. Hope you enjoyed, and I will drop references in the description below. Thank you all and enjoy your day.